So today we are going to discuss a new topic, that is difference between primary and permanent dentition. A few general characteristics about the primary teeth. They are, remember, always the first to form and first to erupt. They develop in 14 weeks of intrauterine life and they will start erupting anywhere from 6 months to 3 years. They are 20 in number. They are also called as deciduous teeth and hence shed off. They are called as predecessors. So, predecessors means something that precedes. So, they will always precede the permanent dentition, whereas the permanent teeth are called as successors because they will succeed the primary teeth. So, the permanent dentition will push off the primary teeth and then take its place. So, they will succeed, and that is why permanent teeth are called as successors. They are also called as milk teeth because these teeth are usually milky white in color and the child many times consumes only milk when these teeth erupt. Remember, you don't feed a child any solid food till the time the child is 6 months old, and from that time itself the primary teeth start erupting. So, that is why they are also called as milk teeth. If you look at this picture here, you can see the skull over there and there are a lot of teeth that are inside the bone, whereas there are some teeth that are outside. So, the ones that are inside the bone will be called as the successors and the ones that are already erupted will be called as the predecessors. So, the predecessor or the preceder are the milk teeth and the successors are the permanent teeth. So, coming on to the general characteristic or the general differences between primary and permanent dentition. Remember, I told you the primary teeth are called as predecessors or preceders, whereas the permanent teeth are called as successors. The primary teeth are called as milk teeth. There is no specific name given to the permanent teeth. Primary teeth are always 20 in number, permanent teeth are 32 in number, but you need not necessarily have all the permanent third molars erupted, but they will be there in the jaws. Even if they are not, still on an average a person will have anywhere between 28 to 32 teeth. Premolars are absent in the deciduous dentition and premolars are present in the permanent dentition. Dental formula, remember we discussed the dental formula. For the deciduous dentition, it is incisors 2 by 2, canine 1 by 1 and molars 2 by 2. The dental formula for permanent dentition is slightly different. So, it is incisors 2 by 2, canine 1 by 1. We have the new entry, that is the premolars 2 by 2, and again the molars we have one extra molar. So, it is molars 3 by 3. The age of eruption for the deciduous dentition is 6 months to 3 years, whereas the age of eruption for the permanent dentition begins from the age of 6 years and it will continue up to 12 years for the second molar, and the third molar will erupt anywhere between 17 to 21 years of age. The deciduous dentition will be replaced by the permanent dentition. The permanent dentition is not replaced by anything else. Now, coming to the functions, I have already told you the functions of deciduous dentition, but let us compare the functions of deciduous and permanent. The deciduous primarily acts as a space maintainer. The permanent does not act as the space maintainer, but its primary function is maintenance of mastication. So, the permanent teeth are important in aesthetics. They make you look good. They are essential in function, so they will help you speak. They are essential for mastication, but these functions are common with the deciduous. So, what is the different function that the deciduous teeth perform which is not done by permanent? That is space maintainer. So, the deciduous dentition acts as a space maintainer, which function is not performed by the permanent dentition.